It's kind of awkward.
Yeah.
Sometimes it takes a little bit longer, so we can just start now. Ready? Hi guys, thanks for joining. This is Essence of Medicine. Today we're talking about the doctor shortage. I'm Amanda Armagast.
I'm Carlos Dabu.
And I'm Dr. Abbasi for Essence. Why did you choose this topic, Amanda?
I don't know exactly why I chose the topic. It's kind of been on the top of my mind for a little bit because we've been doing a lot of not recruiting per se, but talking to different doctors. And I've noticed quite a pattern with things that every doctor that is stopping to be a doctor or leaving their hospital kind of has in common. And since you are a doctor and Carlos is an admin, I thought that this would be a good group to talk about the doctor shortage.
Absolutely.
Actually, I heard that I never really knew that there was technically a doctor shortage until maybe a couple weeks ago when I read something online about it. And then ever since I read something, as you know, I just keep hearing more and more that there's a doctor shortage, which was a shock to me.
Yeah.
Yeah, I mean, in the past, I don't know, 5, 6 years, all I've heard is it's primary care. That's where the shortage is. It's not a field that people are interested in anymore. And it could be a generational thing, is what some people are saying. People want to do the fancier things. They want to go into orthopedics or be a heart surgeon. But now that I've been in the field a little bit longer, I'm seeing that cardiology is another big one, and it's not necessarily just a shortage, but the demand is also getting higher too. We talk about boomers coming into that retirement age. That's an age group, for cardiology that's where they do most of their work. Not necessarily, but that's a huge part of their volume. As that demand grows and there's not enough cardiologists out there, it's an intensive training, but I have a lot of my friends who still work in that space and they're stressed out.
Yeah, I don't know any doctor I've ever met that's not very stressed out with his workload,
Yep.
stressed out with like the system, things like that. Why do you, Dr. Abbasi, think there's a doctor shortage, considering you're in those
Let
shoes?
me talk about the fact first. I work in many rural hospitals. In some of them, 70% of the doctors are first generation immigrant. People who did they're born somewhere else or they have been somewhere else and then they came to United States. And the fact that we have been in United States covering our shortage of doctors with immigrant, this has been going on for almost ever. As a matter of fact, the Filipino doctors are big. They used to be big. Now, Indian doctor, Pakistani doctors, and so on, they have been really helping us to overcome our doctor shortage for many, many, many years. And but and this is good for us because not only then we are covering our shortage of doctors, but because the requirements are so high, we get the best of the best. Imagine, we get forever, USA forever is getting the brightest, the most motivated, the most hardworking people of all the countries around the world. We are getting them here, and they're contributing to our country. And by literally, they have to learn a language, they have to pass many tests, and even then most of the time in the work situation they are disadvantaged, meaning they have to be better than our average or our own doctors to have similar position and so on. And this is a fact. As immigrant, that is, Carlos, probably your parent. I know you are born here, but probably your parent had to deal with the same thing. And that's nothing unusual. This has been good for us, and we have been covering that. But that becoming even now more difficult. And I'm going to tell you how I feel about that. The fact
Well,
is,
sorry, before you continue, I think it's really interesting that you say that because every week I have someone from outside of the US contacting me saying they want to do some type of fellowship or something with us. But it seems like the rules that the US puts in place, which are understandable, USMLE and different things like that, make it harder for a non-US surgeon or doctor to come here.
it
So
is it's
how
very
are
hard, and that enable us on our side to have the brightest of the brightest, the hardest working. They have to do twice as many. They already passed their medical license in their country, and many of those countries, they're as good as we are. To be very clear about that. We were in India. Those doctors, they have skills. Okay, we just started importing endoscopy from them in the spine. They have been doing it for 20 years, and they are good at it. But if they come here, they have to go back to residency. They have to work a lot harder to be even at the same level. And the question is, for the primary, obviously, we had a path. We were always short. And this has been, you and I, we just watched a movie that about the Persian doctor who came to the United States recently. It's called The Persian Version, about how their life changed and what they had to go through. But once you understand that, you understand these people are motivated to be here. Okay? And they're willing to work harder than anybody else. Now, as Carlos just said, but we didn't have much, actually, until 20 years ago, we didn't have much shortage of the specialist. But now we do. And it's an interesting thing I'm going to get into. Why are we now short of doctors across the board? Because until the regular, I would say just regular born and raised American, they had no interest to be primary care physicians somewhere in Kansas or rural Minnesota. They never were interested in that. So we could cover that. But regular born and raised American, they have less and less interest as well to be a specialist.
But why?
In neurosurgery, I will come back to that, but in neurosurgery or spine, you notice that almost half of, if not more, of the people we connect to, they're first or second generation, foreigners. Now, Carlos, your observation is very correct that it was in primary and it wasn't a big deal in the specialist, and increasing the number of the people who need medical care is just one reason. And that's correct. But the fact is that many people don't want to be a doctor anymore. One of the things my colleague Dr. Kim told me, he didn't want his children to be a doctor. And as a matter of fact, I told my son Ali, he can do much better. And that's the point. I told him he can do much better than being a doctor. So imagine you are done with your K-12. Carlos, tell us, what does it take to be a doctor after K-12?
Yeah, after that, you got to get your bachelor's. So that's another 4-year pre-med, and then another 4 years of med school. And then after that, depending on what you want to do, you have residency. And then even after that, if you want to be a specialist, you're probably going to do another fellowship. And it might not stop there. You might have to do another fellowship. So, you're looking at another, 12 years of education on top?
Yeah, well, at least. I
At least.
23 years after my high school. I did 23 years to be a neurosurgeon. To be a neurosurgeon, I wasn't even board certified. It took me 3 more years to be board certified, which is one of the fastest. In average neurosurgery, the neurosurgeon need about 5 to 7 years to be board certified. I did it in 3 years, and that was very fast. But if you add that to that, it was 26 years. Now, the statistical models are out there. Let's say you become a plumber, an electrician. Right out of high school, you go to a trade school and so on. If you see how much money you make and accumulate along the way and compare it to average doctor, you're better off to be an electrician than a doctor.
Yeah, especially if you look at the hours worked too.
I was just going to say that a lot. Like, I have a friend who's an ER doctor, and every day he's like, oh, I just got paid and it all went to my medical debt. It all went to my student debt.
Yeah, but those models are out there. Those models, you put them, you say you go after high school to the trade school, and you start, being an electrician by the time you are 20 or so, and then you start accumulating money. And then if you accumulate, if you set it in a hourly rate, meaning that, if an electrician would work the same hours that the doctor works, he's so much better off, so much better off. Now, obviously, we only see these doctors that they get big Mercedes and so on, but they're mostly in their 40s and 50s already, and they still have a lot of debt. But those
And they're only driving their Mercedes to work.
yeah.
Yeah,
They're
that's all
only-
they have time for.
Yeah, they're only
That's really
going to
it.
work. They're
quality of the life,
Hmm.
how much you earn. I mean, hands down, become an electrician, no question. Now, except that's not the reason. Money is not the reason you became a doctor. If money is the reason become a doctor, run those numbers. You're better to be a plumber.
Yeah, I think your heart also needs to be in it too.
Yeah.
Especially if you know you're going to take 15, 25 plus years, you have to be motivated, very self-motivated, and it has to come from here. It really
Yep.
does.
physician burnout is like a trending topic on LinkedIn every time I'm on LinkedIn.
And there's a joke, actually. This joke was in German, but in the US it applies the same way. There's a neurosurgeon who has a problem with the plumbing, and he calls the plumber in. The plumber comes and works for half an hour or so and write him a check or write him a bill for $500. And the neurosurgeon says, "What? You were here just for half an hour. I don't make $500 even in an hour." And the plumber says, "Yeah, when I was a neurosurgeon, I didn't used to make that much either." So now, let's move from the financial side to the kind of workload and the stress that comes with the job and with this long education. About 20 years ago, we had a law. The law was saying resident cannot work more than 80 hours a week and have to have 1 day off a week. But we couldn't make it, so we got exemption, so we could work 88 hours. But then it was expected from us that not really write our hours down, because we used to work 120 hours a week.
How many hours are in a week?
168. And we worked 120 of that in a week. Now,
I just don't think that that's safe for the patient. Like, as a
that was the
patient,
reason- that was the reason they brought it in. That was the reason they brought that. But no, this is not about residency and how hard we are working. This is about why we are short of doctors. Why regular Americans don't want to be a doctor anymore. Now, if a plumber can make more money in a lifelong, and and work less actually, and doesn't have to work that hard, and as well, guess what? You do a bad plumbing, what the worst happens?
go back and fix it. Get a bad review.
Yeah.
Now, as a doctor, you have one bad results. What happens?
You can lose your medical license. You can be done.
Yeah, well, and that is and then as well, the amount of the support doctors are getting has declined over years. We have become, healthcare in the United States has become an admin job. Doctors are just irrelevant. They are just commodities, and they are being dealt with as such. And that, in the last 20 years, has led to anybody can do something better is going to go and do something better. Very few, statistically, fewer people want to be a doctor.
I think also part of being a doctor is like that shininess of I'm a doctor. You know what I mean?
No,
But I feel like that's going away too.
Yeah, that shininess is going away too, because I can tell you from my own experience. When I was in Stanford, California 25 years ago, if we would go out and try to date somebody and so on in a club and so on, if you would tell somebody you are a doctor, they just would walk away, because the alternatives are these 23-year-old multi-$100,000 bill or millionaires who are having a Ferrari because they have another job in IT tech, IT or finance and so on. The alternative, if you're a smart person, and you have to be a smart person to be a doctor to a certain degree, the alternatives are so big. You know what? Somebody was but actually boasting about, I used to be a doctor, but I'm now smarter. Now I hire doctors. That is how he was getting dates in Bay Area. He had a small company doing a consulting thing and so on. So that shininess is long gone. And all of that leads to, why we are short of doctors. Okay. Now, there's still some shininess there.
For sure.
Okay. I mean, it's better. It's average. It's usually it carries over more to say I'm a doctor than a plumber. But that plumber, if he's smart enough as the doctor, he's not just a plumber. He has a plumbing company. He makes more money than the doctor. Absolutely. And has 5 vacation and so on and so forth. So, but where it has gotten us is that the shininess is diminished. The money, don't even try that for the money. Then amount of the stress is on your back, amount of the hours that you're working, and then the feeling. I'm telling you that Amanda, you talk to a few doctors, and the burnout.
Mm-hmm.
It seems like everybody is out there to get you. Especially most of these big admin hospitals and so on, they look at the doctors as a commodity. They look at us as, so we are going to plan for 2 CTs, 1 MRIs, 5 surgical microscopes, and 2 surgeons for next 2 years. And the same way that then the microscope has its lifetime, and then they are done and they get a new one, they plan for surgeon exactly that way. And we surgeons, we do have feelings too. So
How many?
What? You're not robots?
How many? Yeah, 2 feelings.
feelings. And we know it, how we are dealt. And this is somebody that I trust, heard it firsthand, that there was a conference of the CEO of the hospitals. And one of them was boasting about that he hires surgeons, squeeze them like this bag of mayonnaise, and then throw them away, and they were all laughing. He heard, I trust that person. He heard it firsthand that that's the feeling many surgeons as well get, that we are a bag of mayonnaise, we get squeezed, everything get out of us, and once there's nothing left in us, they just move to the new bag of mayonnaise. So
these problems are pretty obvious. I mean, it's pretty obvious that the admin's taking advantage of doctors, and doctors are complaining about it, talking about it. But why it's been so long? Why isn't there any change happening?
I'm seeing some change. I mean, from the place I came from, some of their doctors actually just started to unionize for some of these issues. And it was groundbreaking, and no one thought it was actually going to go through, but it did.
I'm surprised by that, actually.
Yeah, it definitely was something unique.
This is the hospital.
Okay, mute it. Mute yourself. I wonder if I can pause it.
I don't know.